Christmas jumper day. Where's your Christmas jumper?
Christmas jumper day, but they could probably do with some of Santa's little helpers at the Lift Academy in southeast London. The head teacher forced to take on 2 extra roles, including supervising lunch, because so many staff and students are off with the flu.
We haven't done anything strangely different. Just asking students to wash their hands, making sure that our classrooms are cleaned far more frequently, making sure that we've got a deep clean at the end of the day as well, just to make sure that everyone's safe and well throughout the course of the day.
The flu season has hit hard and early. Not the super flu NHS England today dubbed it. That isn't a scientific term, but it is still severe. In fact, NHS England data today is stark. The figures show an average of 2,600 patients a day were in a hospital bed last week, up 55% on the week before. That is enough, they said, to fill 3 trust hospitals, and it's a similar picture across the other nations. Monk's Path GP surgery in Solihull has started asking staff and patients with respiratory symptoms to put on masks, echoes of COVID days here in the West Midlands.
On the whole, it's been well received. We've heard that the hospitals are doing exactly the same. I was at the hospital yesterday and saw all the staff there wearing their masks. We believe that, along with hand hygiene and other measures, we will try and keep the spread within the surgery down, because actually sickness absence amongst our staff will contribute to challenges that we may face delivering care on it.
The West Midlands has been hit hard by the flu, and here they say the vaccine uptake has been low in the under 65s.
The messaging is trying to be put out there that vaccination is safe, effective, and for those who are at risk, protects them from hospital admissions.
And just as an aside, Dr Lupoli said GP practices this year in England didn't get any winter funding, just to add to their pressure. Several trusts have declared critical incidents this week. That means asking patients not to come to A&E or diverting them away, including here at the QE in Birmingham. In fact, they only lifted their critical incident this afternoon, and they went into it on Monday. And yet still, today, they say 20% of their beds are taken up with flu patients. And NHSE data shows A&E attendances were a record 2.35 million, and ambulance calls were more than 800,000, nearly 49,000 more than last November across England. What's not in today's figures is the number of patients being cared for in the corridor, despite a promise to publish them. Research yesterday, however, said 1/5 of patients in emergency departments were routinely treated in hallways, waiting rooms and converted offices. A glimmer of hope was raised last night with a government offer to the BMA's resident doctors, who will survey their members. But if they refuse, they will go out on strike on Wednesday at what couldn't be a worse time for the NHS.